A question said that 60-year-old male patient, he is a known case of COPD, presented with acute exacerbations and admitted to ICU. Okay, then what is the initial management for this patient? So we get the answer of these questions. Initial management of this case is non-invasive positive pressure ventilations. Okay, further explain like that. Heather, initial management for acute exacerbation COPD is non-invasive positive pressure ventilations as it reduce the work of breathing and improve the gas exchange. Okay, that's why. And further, management of the acute exacerbation COPD includes here that initial management, where home management includes in home management increase the bronchodilator therapy, short course of the oral glucocorticoids. Okay, and in which cases we refer to the hospital indicator in presenting the patient, where we have to refer the patient to a hospital. Cyanosis, peripheral edema, alter consciousness, and further on comprehensive assessment open admissions. Okay, we check the level of consciousness. Either a patient respond to command or he or she able to cough or not. Okay, sign of CO2 retentions. In a patient with CO2 retentions, there is flapping tremor present in the patient, and the bounding pulse and warm periphery. Airway obstructions assessment, where prolonged expirations and wheezing may be present. Sign of cor pulmonale. Patient with cor pulmonale in response to COPD show raised AVP and peripheral edema because the chance of the increased right heart side failure. Okay. Further, what investigation can be performed in patient with COPD? In ABG and chest X-ray. In ABG, we can see that hypoxemia means there is decrease in partial pressure of oxygens less than 60 mmHg. Hypercapnia, increase in partial pressure of CO2 greater than 40 mmHg. Okay, and chest X-ray identify the complications like pneumonia, pneumothorax, and pleural effusions. And there is a management of the COPD in details, where patient given oxygen therapy to increase the partial pressure of oxygens. Okay, and non-invasive ventilations, and sex third is bronchodilator. In bronchodilator, we use short-acting beta-agonists like salbutamol, terbutaline, with anticholinergic drugs like ipatropine bromide. And for the glucocorticoids, we use oral dose of prednisolone 30 mg for 10 days to reduce symptoms and improve lung functions. Further, antibiotic therapy, okay, and mechanical ventilations. This is And additional therapy includes like diuretic for peripheral edema, as patients also develop peripheral edema. Simple. This is a case of acute exacerbation of COPD.